Hi, my name is Jeff Jordan, President and Executive Creative Director at Rescue Agency. And today we're going to talk about radically selfless health communications, developing trauma-informed and social group-informed messages for teens. Now, what is radically selfless health communications? Well, first, let's talk a little bit about change. Change is a burden. Change is difficult. Doesn't matter how old you are, it is hard to change your behaviors. And it is even harder when there are things that are getting in your way. And so when we think about teenagers and we think about the healthy behaviors that we want them to perform, there's a lot of things that could get in their way. Now, in prevention, we tend to focus on why. Why do we want a teenager to change? Because it's unhealthy, because it's hurting their bodies, because of this and that. We've got all of our reasons, all of our science, all of our facts, right? But for a teen, many of them don't know how to change. And I'm not talking about just the process of not doing something, but I'm actually talking about the how does it fit within their life, right? Within their social group, within the past experiences that they've had, within the adversity that they faced, and within the trauma that they may have experienced. Now, a health campaign, a mass media campaign, it can't undo the trauma that some of our young people are facing. But what it can do is it can help them make their lives better by explaining how this health behavior that we're offering them that's going to make their life better, how it actually fits within their life and how it can improve the life that they're living. But to do that, we need to make sure that messages actually help teens understand how to change, because that will reduce the burden of change. Right? Change is hard enough, but we can actually make change better and easier by helping them understand how it fits into their lives. And that kind of campaign, a campaign that takes into account a teenager's social group, a teenager's trauma, a teenager's real world, is a radically selfless campaign. Why radically selfless? Because think about how infrequently we do that. How many health campaigns out there are exclusively about the things that we in public health care about, the facts that we care about, the health consequences that we care about, and how many of them actually take into account the real lives that young people are facing? When campaigns are designed for the real world, for the real trauma that people face, for the real social groups that they belong to, that's when a campaign becomes radically selfless. So let's talk about how to do that. The first thing is we have to make sure they're social group informed. And now we have a lot of videos on PeerKratz, so I'm not going to go deep into it. Just a quick reminder, if you want to learn more, click on the link and you can watch a full overview of PeerKratz. But very quickly, PeerKratz are the macro level connections between peer groups with similar interests, lifestyles, influencers, and habits. And as you know from our studies across the country, over the past 10 years, there's about 5 peer crowds that we always find no matter where we go. Those are the popular peer crowd, mainstream, alternative, country, and hip hop. And again, we've got other videos that'll go into that in detail if you're interested. And what we know from that research is that each of those peer crowds face different risk behaviors. So here's a quick little bit of data from our most recent survey in Virginia in partnership with the Virginia Foundation for Healthy Youth as part of their Virginia Youth Survey. What we know is that in 2017, about 14.9% of Virginia teens had used a tobacco product in the past 30 days. However, only 3% of mainstream teens had used that tobacco product compared to 21% of hip hop teens, followed by 18% of popular teens. And then if we look at specific tobacco products individually, we know that only 5.9% of Virginia teens had smoked a cigarette, but it was 11.6% of alternative teens, followed by 8.5% of country teens. And if we look at cigars and cigarillos, it was about 5.9% overall, but about 10.7% of hip hop teens. And look again, that mainstream number continues to be extremely low. Only 1% of them had used this product. Smokeless tobacco use, well, we're looking at about a 3.9% overall, but it's 9.8% amongst country teens. So as we're seeing, as we're looking behavior by behavior, product by product, we see the norms are different depending on what group you belong to. Finally, looking at e-cigs and vaping products, it was about 11.9% overall, but 18.3% for popular teens, followed by 14.6% for hip-hop teens. And again, look at that mainstream number, only at 2.4%. Finally, when we look at a hookah use, it's about 3.6% overall, but it's about 7.6% for hip-hop teens. So what does this all tell us? Well, it tells us that not everyone is at risk for the same products. Even within one category of risk, tobacco use, we find that depending on which product you're looking at, it's a completely different group of teens that are using it. And every one of those teens, when we ask them to change, they're going to process that message through the lens of their own social group. And they're going to think, what will it mean for me as a country teen, as an alternative teen, to change within my group, within my culture that is using this product disproportionately? And they're going to think about what that means for them socially. And so as public health advocates, we can make messages that show them how to be tobacco-free within the lens of their own social group. But first we have to understand what group they belong to. And that's where PeerKratz science helps us. However, it's not just about PeerKratz, right? We're here to talk about trauma-informed messages and what that actually means. Well, here's how PeerKratz can actually help us understand some of the things that teenagers are facing and going through. PeerKratz theory is based on the idea that young people have life experiences that shape their attitudes and values. These attitudes and values then lead them to find others who they identify with. And these others are what shape their peer crowds. So while yes, there's going to be dabbling in different groups, for the most part, teens are going to end up with other teenagers who have had similar experiences and have similar worldviews, similar values. These similarities are what lead to the similarities in behaviors, right? They identify with these other young people that have similar experiences and values as they do, and then they adopt those same norms because there's a logic to those norms within the values and beliefs of their group. Now, this, for the most part, continues to be a theory since PeerKratz science is still fairly new. But we have some new data that helps us understand a little bit more of what may be driving some teens into some peer crowds over others. Recently, we were able to incorporate an adverse childhood experiences scale into one of our PeerKratz studies, also in Virginia, so we have some comparable data here for the other PeerKratz data I just shared. Now, we used an ACEs scale of 9 adverse childhood experiences. This is not the full ACEs scale that is used with adults. It is a simplified scale that's a little bit more appropriate to use directly with teenagers. You can see the 9 questions on the screen. It asks about financial difficulty, divorce, apparent death, a parent or guardian serving time in jail, seeing or hearing violence in the home, living with someone with mental illness, living with someone with a drug or alcohol problem, witnessing violence in their neighborhood, and finally experiencing racism. We asked these 9 questions to a cohort of about 1,000 different teens and also asked them about their peer crowds to see if there was any kind of connection between these 2 variables. And what we found was that there was a really big connection. On average on this study, each teenager had experienced about 2.4 ACEs, but we saw that there was a disproportionate number of ACEs experienced within the alternative and hip-hop groups. Alternative teens on average experienced 3.6 ACEs, and hip-hop teens on average 3.3. In comparison, mainstream was just at 2.3, country at 1.8, and popular at 2 ACEs in their lifetimes. What that means is that hip-hop and alternative teens on average are experiencing at least 1 more ACE than their peers, and sometimes even more. Now, when we actually look at the odds of PeerKratz identification and ACEs, for every single adverse childhood experience that a teenager has faced in their life, their odds of being alternative go up by 20%, and their odds of being hip-hop go up by 16%. Similarly, their odds of being popular, being part of the popular group, go down for every single ACE that they experience. Right? So this is a pretty robust relationship that we're observing between PeerKratz identification and adverse childhood experiences. And when we actually dive even deeper, we can see a different kind of experience for the 2 high-risk peer crowds. Alternative teens, so what we did for this final analysis is we looked at home experiences versus environmental experiences. So home experiences having to do with parents, having to do with others that you're living with, while the environmental experiences pulled out specifically having witnessed neighborhood violence and having experienced racism. And what we found was that alternative teens were significantly more likely to have experienced home adverse childhood experiences, like a parent divorce, mental illness, etc. A young person who has experienced a home-based ACE is 23% more likely to be alternative. In contrast, hip-hop teens were more likely to have experienced environmental adversities, either witnessing violence in their neighborhood or having been treated unfairly because of their race or ethnicity. For every one of those two ACEs, a young person was 60% more likely to identify with the hip-hop peer crowd. So what this means is we even have two different kinds of adverse experiences leading young people to identify with different groups. This is all extremely important information because it is now blending two pieces of communication that are extremely important. We have our peer crowds, which tell us a lot about the values a young person might have, the look and style that we might want to communicate with, and now we have adverse childhood experiences that tell us a lot more about what they're currently facing and in what context the behavior change needs to occur. Now, putting these two pieces of data together, we're able to see how segmentation really acts as a prism for us. It gives us the clear and distinct values that young people have, experiences that they face. Really, the science just got even deeper thanks to this new study. So what does this mean to create messages that actually reduce burden? Well, it means that we are taking into account the things that young people are facing, right? First and foremost, we want social group informed messages. That means that we've taken into consideration who are the young people that are actually engaging in the risk behaviors and developing messages specifically for that group. Second, we want it to be value informed, right? What do the young people care about? What do they think about? What is important to them? And how do we make the health behavior fit into that kind of value frame that they have in their own life? And now, most importantly, we want it to be trauma informed. Trauma-informed messages. What does that mean? Is that we're taking into consideration what has a young person experienced in their life, and then we are crafting messages that take that experience into account and show them how this change can be realistic for someone like them. Because otherwise they're going to look at our message and say, well, that works for someone else, but it doesn't work for someone like me, someone who has faced what I face, someone who's dealing with what I'm dealing with. And that's our most important audience, right? That's our highest at-risk audience. We don't want them to be the ones that are exempting themselves from the messages that we're trying to deliver. So, trauma-informed messages combined with value-informed and social group-informed messages are going to provide the strongest chance of causing change and are going to be the most radically selfless messages we can make. Because it's no longer about us, it's no longer about what diseases and what kind of health consequences we're worried about. It is now about the young people, what they're facing, what their world is like, and how being healthier, engaging in healthier behaviors can actually make their life better. So, let me give you an example. Before I show you these, I want to be very clear. There are some serious things that young people are going through, and there is no marketing campaign that can eliminate these traumas from their life. And so there are other things that need to happen. However, what we can do in marketing and what we can do in health communications is design messages that help young people see how health can fit within the context of what's going on in their life. It won't be the only thing they need, but it does allow us to reach some of our highest risk audience more effectively. So here's a first example of how we can have social group informed, value informed, and trauma informed messages in a tobacco control campaign. This first one is for our country audience. Take a look.
Dad handed down a lot to me. This truck, my work ethic, my shot, but our time was cut short when I lost him to mouth cancer caused by dipping. People say I remind them of him. I can see why, but when it comes to dip, we're not the same, because I plan to be around a lot longer than he was. And you know, I think he'd be good with that. My life, my legacy will be tobacco free.
All right, this first video is from a campaign called Down and Dirty that we've developed over the past 5 or 6 years now. And this message talked specifically about a very clear ACEs, which is death of a parent. Now, again, no campaign can help a young person deal with something as traumatic as losing one of their parents. But what it can do is it can put that adversity into context. It can help them understand how this health behavior that we're promoting fits within someone's life who maybe is experiencing maybe a death, but maybe not even a death. Maybe it's just adverse experiences for those parents, health consequences that those parents are facing, and how they can change within that context. Right? So this is, again, an early example of how a trauma-informed message can make a tobacco control message more impactful. Let me show you one more example.
Little Lila When she says she don't want you and you're feeling at your lowest, most broken and lost, you will find a way. Safe from the dark places and the troubles that chase you, you will find a way. Or you will learn your sexuality is not a curse, where negative thoughts won't cloud your mind, where nothing will hurt your spirit or your body, yours to protect, and anything toxic you'll reject, including cigarettes that can damage nearly every part of your body. Little Lila, you have found your voice, and you are already on your way home.
This free life, freedom to be tobacco-free.
This ad is part of our national This Free Life campaign for LGBT young adults. And what you can see clearly in this video is that it takes into account a lot of the trauma that many LGBT people face growing up. And it takes it and helps those young adults understand, well, how does tobacco use fit into that context, right? If young adults are using tobacco use to cope with some of the things that they may have faced in their childhood, could that same person actually look at abstinence from tobacco use as a way to grow from the things that they face in their life? And that insight, that message only comes from a place of first understanding the trauma that this population has faced before even developing any of these messages. And that's really the power and the potential of a trauma-informed message, a social group-informed message, and a value-informed message, is that we're able to look at everything that a young adult or a young person is facing and incorporate it into the crafting of the message that's coming together. I have one final example for you. Take a look.
You see, my mom's double shift wasn't in vain. Low achiever, at risk, disregarded. I will break that chain. Pain, disease, death, cigarettes were to blame. But I overcame the block. And the shock when my grandpa's lung cancer caused by cigarettes was caught. Distraught and left alone. Had 3 generations in one home. Not broken, but awoken. Setting sights on CEO of independence as my goal. So I reject cigarettes to regain control.
Keep it fresh. Live tobacco-free.
This final ad is part of the National Fresh Empire campaign for hip hop youth. And it packs a lot. But if you listen to what the young lady is saying, what we're hearing is a life full of adversity. A life of adversity of a cycle of addiction, of death and disease, all that she's had to overcome. And what we've seen is that she has helped us understand how living free from tobacco use is a part of how she is enduring those experiences, how she is overcoming and ensuring that her generation and her family and her future is going to actually avoid this same cycle of addiction and this same cycle of death and disease through the absence, through not using tobacco, right? So again, we're taking into account what a young person has faced, and we're putting our health messages into their world. Rather than sitting on our ivory tower and talking about why we think young people shouldn't smoke, we are showing them why being tobacco-free matters to them and matters to what they care about. Because preventing risky behaviors is more than just about facts, right? It's more than just telling people why something is harmful. It's about helping young people understand how living healthy actually fits within their real life, their real, complicated, difficult lives that they may be facing, how this health behavior can actually make those lives better. And that's not only going to help them live healthier, it's also going to help them put a lot of things into context. Again, there's only a limited amount of work we can do through media. But we can be a lot more effective and cause a lot more change if we develop messages that are trauma-informed, social group-informed, and value-informed. I hope that was helpful. Thank you very much for watching. I encourage you to check out some of the other videos on our YouTube channel. And if you hadn't seen yet any of our PeerKratz video to fully understand the science of PeerKratz, I encourage you to check that one out. The link is attached. Thank you very much, and we'll see you again soon.